Do you frequently feel like your heart aches sometimes? Or maybe your child gets tired very quickly after eating normal food? Or perhaps they have a swollen belly and keep crying from joint pain. These could be signs that something is wrong with how their body handles certain proteins. One rare but serious condition that can cause such symptoms is tyrosinemia. It's not about heart or joints directly. It's about a tiny chemical in your body called tyrosine. Normally, your body breaks it down safely. But in tyrosinemia, that process breaks down like a clogged kitchen sink. The waste builds up and starts hurting the liver, kidneys, and even the nerves. It's rare, but dangerous if not caught early. Let's walk through it like we're solving a mystery together, because early clues can save lives. So what causes this clogged sink in the body? Imagine you are making a sandwich and each step needs a special tool like a knife for slicing cheese. In your body breaking down tyrosine, a part of protein needs special tools too. They are called enzymes. Tyrosinemia happens when one of these enzyme tools is broken or missing. Type 1 is caused by a faulty enzyme called fumarylacetosidate hydrolase, FAH. Without it, toxic stuff builds up and hurts the liver and kidneys. Type 2 happens when the enzyme tyrosine aminotransferase doesn't work. This mainly affects eyes and skin. Type 3 is rarer and involves another enzyme, HPD, leading to nervous system issues. All three types come from parents passing down a broken gene, like inheriting a faulty manual for building something. If both parents carry the broken gene, their child could get the disease. It is like winning the wrong lottery. Now, how do you know if someone might have tyrosinemia? Let's play detective. For type 1 common in babies, imagine a 3-month-old crying more than usual with a bloated belly, bad smelling cabbage like sweat, and not gaining weight. Their liver might be swollen. Feel their belly gently, and it feels hard. They might bleed easily or have diarrhea. For type 2, it often shows up in kids aged 2 to 4. Picture a child constantly rubbing their eyes red and painful, or getting painful sores on their hands or feet when walking barefoot. They may avoid bright lights too. Type 3 is the sneakiest. Symptoms might be mild or even absent, but some kids have seizures or learning issues. These signs aren't just random, they're clues from the body screaming for help. Ignoring them is like ignoring smoke in your kitchen. First they ask, does your baby have odd-smelling sweat? Is their liver big? Then they do blood and urine tests, like checking water for dirt in a clogged pipe. For tyrosinemia, a key clue is high levels of a substance called succinylacetone in urine, unique to type 1. Genetic testing confirms which gene is broken. Once diagnosed, treatment starts fast. For type 1, the main drug is nitasinone, NTBC. It stops the toxic buildup, like turning off a polluted faucet. But there's a catch. The patient must eat a special low tyrosine, low phenylalanine diet. No regular baby formula or meat-heavy meals. Think of it like a car that can't handle regular fuel. It needs a special mix. Liver transplant is an option if damage is severe. Type 2 also needs diet control and eye drops for pain. Regular checkups are like tune-ups to keep the body running smoothly. Can we prevent tyrosinemia? Well, we can't change genes yet, but we can catch it early. Newborn screening is like a smoke alarm for rare diseases. In many countries, babies get a heel prick test within days of birth, which can spot tyrosinemia type 1 early, before symptoms start. If you're planning a family and have a history of the disease, genetic counseling is wise, like checking a house blueprint before building. Couples can get tested to see if they carry the faulty gene. And if a child is diagnosed, sticking to the special diet is prevention of crises. It's not about being perfect, it's about being prepared. Prevention here isn't stopping the gene, it's stopping damage before it starts. Exciting things are happening in research. Scientists are exploring gene therapy. Imagine fixing the broken enzyme tool by delivering a healthy gene directly into the liver, like sending a software update to a phone. Early trials in animals show promise. Also, better forms of nitasinone are being tested to reduce side effects. Newborn screening is expanding globally, catching cases earlier. Some researchers are working on smart diets using medical foods that taste better so kids don't feel left out at dinner. There's even work on CRISPR to correct the faulty gene in embryos, though that's still in labs. The future, maybe one day, tyrosinemia could be corrected before birth. We're not there yet, but we're moving fast, one discovery at a time.